everyone, welcome to the Body Manual. My name is Annabelle and I'll be your physical therapist today. So yesterday we talked about the quads muscles. It's a group of 4 muscles in the front of your thighs. The intermedius or vastus intermedius, which is the deepest. There's the vastus medialis, which is the inner part of the quads, and the vastus lateralis, which is the outer part of the quads, and also the rectus femoris. So I mentioned that the quads extend the knee, or it straightens the knee, okay? And there's also the vastus, and there's also the rectus femoris, which is the last one I mentioned, that's connected or crosses the knee and the hip joint. So what that does, because it crosses the hip joint, is that it helps to lift the leg up or the thigh up, or it helps to flex the hip joint. So it's important to keep the quads not so tight, or I don't want to say loose because I don't want them loose either, but a lot of times people forget to stretch those muscles. So when that happens, or because people forget to stretch their muscles, it can possibly lead to the knees clicking, or the kneecaps clicking, or there are times when people feel that their kneecap or their knee is stuck, so they tend to just kind of unlock it by kicking out. So if you notice yourself doing that, try to look at how tight the quads muscles are. Another thing is if there's some, you might not feel the soreness, but if you just kind of palpate or feel for it and you feel some tightness or feel some soreness, most likely they're tight. So I'm going to show you a part of manual therapy, which is called soft tissue mobilization. So some people might call it massage, but we call it soft tissue mobilization, and it's not the relaxing type. It's more to help decrease the tightness, and also to help promote the blood to circulate in those areas. So I start by tracing the kneecap or the patella. So if you think of the patella as the sun, you want to trace the sun rays away from the sun. So you might feel some tenderness anywhere along there, so be careful. Listen to your body, okay? So you don't have to push too hard if you're feeling tenderness, but making this motion will actually help with mobility. So right here also between your tibia and your patella, so there's a ligament there. Ligaments are connective tissue that connect bones together. So just like that. And then look for the tendon of the kneecap or the quads. Just like that. Okay? And then, so from here, I would use my thumb and just scoop up in this direction. Think about where the border of the muscles are, or what it looks like, and you can pretty much make a guess of where it's located in your body. Okay, and if you're not exactly at the quads muscle, that's okay. Wherever you feel the tightness or the soreness or the pain is most likely where those muscles are tight. That's just a general rule. And when you're feeling for them, you don't want to just, oh, I do this all the time. It doesn't really target those muscles that are tight or that needs attention. So what I do is I kind of I push in, and then I keep my finger or my thumb or my hand on the same depth. And then from there, I just work at the border of the muscle. And when you do that, it allows for the muscle to glide up and down, and you want the layers to be able to glide with each other. And then you can also use the heel of your hands. It's easier with pants or lotion, but I just wanted to show you those muscles and how to look for them. So basically, I'm feeling for your quad is the top part of the your thigh or the front part. So I'm just feeling for the border. If you have soft tissue kind of in the way, that's okay. Just get in there and you'll be able to go through. And your goal is to think you're not really trying to get to the bone, but your goal is to rub that muscle against the bone. And just let your skin, you're attacking the skin down and just gliding your skin over the muscle. So it's not like this. It's not where you're not sliding your hand over the skin. You're keeping that grip, hold it down, and pull up. Just like that, okay? Same thing here, I use my thumb. Or I even tell people to use a back buddy, or in this case, you can use a rolling pin or like a wooden spatula and just kind of go for it, the border, be gentle at first, and you can, familiarize yourself with how your muscles feel, just like that. And then that rectus femoris, so a lot of times that's often overlooked. So the tendon for the rectus femoris, tendons are what connects the muscle. It's part of the muscle. It continues as a tendon and it attaches to the bone. So it attaches to the ASIS, anterior superior iliac spine. So where it attaches is like part of that hip bone in the front, and what you want to do is make a U with your thumb. So I'm making a U. So it's going to feel ticklish and it'll feel tender, and you can easily feel this when you lean back as well, just like that. And then from there I go for the tendon and use my thumbs, or you can use your knuckles, or if you have a massage tool that will help as well. Same thing here. Just like that. So that should help keep the muscle not so tight. If you have any questions, please feel free to leave a comment, leave me a message, or just email me. Thank you.